and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Chinenye Onyemaechi. She's a psychiatrist and she wrote the KevinMD article, Redefining the Role of Psychiatrists in the Time of COVID-19. Chinenye, welcome to the show.
Thank you so much for having me.
So we'll get into your article in a bit, but first off, tell me your story and your journey to where you are today.
Yeah, so like you said, I'm a board certified psychiatrist. I trained at the University of Maryland Medical Center, Sheppard Pratt, where I did my adult training. And I also did an extra year of fellowship training in forensic psychiatry. I'm from Maryland, but from there, I decided to take the leap and go into locum tenens work. So I'm actually a full-time locum tenens psychiatrist. I've worked in 4 states. I'm licensed in 6. I'm actually working on the 7th one. And right now I'm in Southwest Michigan.
And how has the pandemic affected you and your locum tenens practice?
Yes, that's a great question. It's definitely affected the number of locum opportunities available. I was fortunate in that I already had planned to be in my current assignment for some time. But in psychiatry, unlike other medical units, I work as an inpatient psychiatrist, so our patients don't tend to stay in their rooms. They're walking all over the unit, going to groups, doing activities. So we had to reduce our census, allow people to have private rooms so it would be safe.
Sure. And what kind of behavioral health issues have you been seeing as a result of the pandemic?
Yes, I've been seeing people who have had recurrent episodes of their mental illness. So mania, for instance, a hallmark of bipolar disorder. People are getting stressed, losing sleep, and that leads to a manic episode or a psychotic episode. Seeing more people coming in with depressive symptoms, anxiety from quarantine, staying home. They've lost a lot of the structures that have held them in place that have been a coping mechanism, like work or just leaving the house, going out to eat. So it's really been affecting a lot of people. And
that segues nicely into the article that you wrote for KevinMD, Redefining the Role of Psychiatrists in a Time of COVID-19. Now, can you tell me the main thrust of that article and why you decided to write it?
Yeah, so my expertise is actually in emergency and crisis psychiatry. So I could recognize with just how intense and pervasive the pandemic was back. I wrote this, I believe, in April. So back in March, I could see that this was going to have a huge impact. And even in the mental health world, we're anticipating a mental health tsunami to come out of this. So I recognize, or at least I believe, psychiatrists are well positioned to be helpful to not just the medical community, but society as a whole as far as how to make sense of what's going on. So that's where this article came from.
So what kind of issues do you see going forward from a behavioral health standpoint?
Sure. So in any disaster, the research has shown that depression and post-traumatic stress disorder are the 2 major manifestations that happen psychologically after a crisis. Just broadly speaking, anxiety is the most common mental health disorder. And so we're already seeing that a lot of people feeling anxious, fearful, whether they're afraid of just getting contaminated, catching the virus with the restrictions, not really understanding what's going on. Some of the information we've gotten is so inconsistent. So those are what we'll largely see: a lot of depression, a lot of anxiety, a lot of trauma responses.
Now, from a behavioral health standpoint, what kind of tips can you give to both primary care doctors like myself and in an acute emergency setting?
Yes, so that's a great question. I would say just knowing, for one, the common mental health or behavioral health problems that come from a crisis. So look out in your patients for depression, screen for that, screen for anxiety. You can let patients know that there are certain tools available online. Google recently partnered with the National Alliance for Mental Illness, or NAMI, to have an anxiety screen on Google. So if your patients Google anxiety, they can see the GAD-7 screen pop up, and they can do that assessment at home. And then they can share those results with you, can talk about it. Also recognizing trauma reactions are actually normal. They're not necessarily the same as having post-traumatic stress disorder, so feeling fearful, having difficulty sleeping. You know, these are things in the here and now that you can help your patients with, helping them with sleep, if they need a sleep aid temporarily, making sure they have access to you if they need a referral to a mental health clinician, knowing that a lot of mental health providers are seeing patients through telemedicine, so that the resources available. I've just noticed in my practice, a lot of people don't recognize what's going on is actually normal, and they get fearful and think it's pathological, and they're afraid to get help. So being that normalizing, calming entity to reassure them is a great help.
Now, is there something that you've learned during the pandemic? In other words, is there something that you know now that you wish you knew back before the pandemic started?
Oh, wow. I think I've just, for myself personally, I've just become more grateful for where I've come, where I've been in life, and that I've developed this training that I can give to other people. And I think that's the best thing, really, because the pandemic came upon us so suddenly. Our lives have changed. We have to come up with a new normal. Our way of seeing the world has been shattered. And so while it's sort of like a tower moment where things are crumbling, I do see there's a lot of growth moving forward from this.
Now, you're locum tenens psychiatrist, and that gives you a little bit of a different perspective in terms of
Mm-hmm.
the field as a whole. Now,
Yes.
we're looking at what you said, a tsunami of behavioral health issues leading to the pandemic. Is the mental health workforce, are they up to that tsunami of cases going forward?
You mean as just having the personnel ready to, already psychiatrists are one of the most in-demand specialists in medicine. We're aging out, and there's not as many of us in areas of need. So we're going to have to rely more on primary care providers to be able to screen, on telemedicine, telepsychiatry to improve access, and also mental health literacy and education, something I'm personally interested in. So just the public, they know what to be looking for. I think part of it is just access and people not realizing what is a psychiatric emergency, or what is a behavioral health problem that needs to be addressed.
Sure. Now let's take a step back. And I was wondering if you could share with my audience something that you've been curious about or something that you've been passionate about over the last few months.
That I've been very passionate about mental health literacy. Um, I've learned that many people don't know what mental illness looks like, or they don't recognize that they're going through trauma reactions. They think it's normal, in the sense that everybody, something to dismiss. That's not something to be addressed. So I'm trying to work on, like, my article, putting out more information, showing that psychiatrists are available, highlighting things that are normal experiences, what are abnormal, or things that need a point of intervention. So that's something I've been really passionate about, just teaching more about mental health. It's already starting to come more into the surface, more into public conversation. But I think just having more expertise available is going to be helpful.
Well, thank you so much for sharing your time, wisdom, and insight. And my final question to you is, what's your take-home message for the KevinMD audience?
My take-home message is to take care of yourself, develop some self-care practices. The biggest thing I can say is think about your medical training or the hardest experiences of your life. What did you do to cope then? Bring those tools back. They will help you now.
Wonderful. And thank you so much for sharing your advice and your story. And thank you for being on the show.
Thank you.